Hi, I'm Dr. Jen Gunter. I'm an OBGYN and author of the Menopause Manifesto, and I'm here to answer some questions. When I was on tour for the Vagina Bible, at almost every stop, well, I think at every stop, there were questions about menopause, totally unrelated to the vagina. They weren't like, my vagina's dry questions. It was like questions about, should I be taking hormones? I have depression, all these sort of intricate questions. And I was like, wait a minute, like, how does nobody know this? The vagina and the vulva is rated as shameful, right? By this sort of patriarchal system that we're in. You can't talk about it. It's down there, but there's still whispers about it. And it's on the cover of women's magazines, like traditional women's magazines, like Glamour. They always want to tell you about vaginal mayhem, right? Everybody's like interested in scaring you about the vagina and vulva, because that sort of ties into purity culture and patriarchy. But nobody was having conversations about menopause. And I started looking around and I was like, wow, that's like totally been erased from our public discourse. So menopause is the planned end of ovarian function that happens around the average age of 51. But there are many symptoms that are kind of a lead up in the years before called the menopause transition. Menopause itself is said to happen a year after your final period, because you don't know it's your final period until it's your final period. But looking back, you'd say you're menopausal from the age of your final period onwards. The menopause transition is what's often referred to also as premenopause or perimenopause. And that is that time period leading up to the final menstrual period. And that's kind of a time of hormonal chaos. The ovaries are sometimes making more estrogen than normal, sometimes making less, sometimes there's breaks in between. And the menopause transition is really like puberty in reverse. There is an increased risk of having depression triggered during the menopause transition. And there's also an increased risk of anxiety as well. And that can be super complex because when people have hot flushes or hot flashes, they can also feel anxious from that. And so the symptoms can kind of overlap and it can be hard to tell, kind of which is which. So I would say that somebody with a history of depression and anxiety should really just be on the lookout to make sure that they're not having a worsening in their depression or anxiety. And if they do, to really, bring that up with their healthcare providers. So if there's treatment available or they need to change their therapy, or maybe even for some people, there might be a consideration for menopausal hormone therapy to sort of even things out. It's going to depend on a individual case-by-case basis. But I think just having the knowledge and being aware of that possibility is really empowering. So menopause can affect sex drive, and it can also affect sexual performance. So we'll talk about like performance first, meaning from a pain standpoint. If you're someone with a vagina and you have the decrease in estrogen, you may very well get vaginal dryness. You may get discomfort with vaginal penetration, and obviously, if it hurts to be touched, you're not going to want to be touched, and that can absolutely affect libido and drive. And there is great therapy for that. So there's all kinds of treatments. There's vaginal estrogen, and there's also a vaginal DHEA product, which is sort of like a pro-drug to estrogen. And those drugs are not absorbed into the bloodstream. So we often even use these medications for trans men who are taking testosterone, because sometimes they can have some effects in their vagina. And so we even use these medications, for people who might be having vaginal dryness earlier in their life for other reasons. And so they're, really very safe. They're very effective, and we can replace sort of the hormones vaginally with a variety of different ways. So basically, it can be customized for you. I would say that's really the answer. So making things so they don't hurt is one way. Also, there are so many amazing over-the-counter moisturizers that can be really useful, and they're bioadhesive, meaning they cling to the tissues. So you insert them about every 3 days, and that can also help a lot with vaginal dryness. So there's some really good therapies for that. From a sex drive perspective, that's far more complicated, and that's really more like that puzzle. For some people, there is an increase in loss in libido associated with menopause, and the exact reason isn't known because hormone levels are actually not predictive of sex drive. So for example, if you're someone who's had depression that's been triggered during your menopause transition, that can affect sex drive. If you have pain, that can affect sex drive. If you're not sleeping well because of hot flushes at night, or you've developed sleep apnea, which it starts to increase during the menopause transition, those are all going to affect libido. And then also too, for someone who's in a long-term partnered relationship, libido waxes and wanes over time as well. And, we have to also learn to tolerate the lows as well as celebrate the highs. And so, for many people, there's a fantastic book that I always recommend by a Canadian expert in libido, Dr. Lori Brotto, Better Sex Through Mindfulness. And so there's many other fantastic resources from sex therapists to help with that as well. And that's usually the go-to initial treatment is, working with a sex therapist. And there are medications for libido, but in general, the results are pretty underwhelming, I would say. And they are also really have only been tested in heterosexual relationships. And I'll also add that they are tested really in heterosexual relationships that don't really apply even to how I would apply it to the general population, in the sense that most people in the studies are already having a fair amount of sex. And so, you're getting an increase maybe of like 1 episode a month. And so we don't have any ways how to translate these drugs to people who are having sex once or twice a year. So how we would translate that, to the general population, who's not a heterosexual couple already having, sex a couple of times a month, we just don't know. People are always shocked to find out that hormone levels don't really, predict libido in menopause. There's women who have higher levels of testosterone who have low libido, and women who have rock bottom levels of testosterone and have very high libido. I'm not a testosterone researcher in any way, but I think that we've been sold a bill of goods about testosterone because it's been a lot of part of patriarchal messaging for a long time. And so I think that, we've only heard one part of the story, right? But hormones are super complicated, just like the people who have them. And, to assume that one hormone is always going to do one thing for every person, especially something as complex as testosterone is, or any hormone, all hormones are super complex. The answers are not usually yes or no, or always or never. And, for example, as I mentioned in the book, women who have polycystic ovarian syndrome, which is a condition with disordered ovulation, they typically have higher levels of testosterone and they don't have higher levels of libido. You can find me on Twitter at Dr. Jen Gunter, on Instagram at Dr. Jen Gunter. I have a Substack called The Vagina with a J, play on words. And I have a new podcast with the TED Audio Collective called Body Stuff with Dr. Jen Gunter. The book is the Menopause Manifesto, and it was published on May 25th, and you can get it everywhere that you can buy books.